My name is Melissa Farmer. I'm a pain psychologist and neuroscientist with over 16 years of experience treating people with who live with all types of hard to treat pain. I'm also co-founder of Aivo Health, the company that's co-sponsoring this webinar. And I'm delighted to introduce Dr. Vania Apkarian, who I trained with for 8 years at Northwestern University. Dr. Apkarian is a professor of neuroscience, anesthesia, and physical medicine and rehabilitation. And he's a pioneering neuroscientist whose science is based on listening to patients with chronic pain. So Dr. Apkarian has revolutionized the field of pain research, in my opinion, by showing for the first time that chronic pain changes the brain. And he's discovered over the last 20 years the brain circuits that predict who will develop chronic back pain in the future. And he's published over 300 peer-reviewed articles. His work has been cited over 21,000 times in published papers. And over the past 20 years, his work has shown that emotional brain circuits underlie brain changes related to chronic pain. So I'd like to thank you for coming and for joining us, Dr. Apkarian.
Thank you, Melissa, for that kind introduction. I'm happy to be here.
Excellent. So I'm just going to briefly go over the scope of our conversation today. At the very beginning, I'm going to discuss for just a moment or so why we pay attention to pain, why pain is so salient. And then I'll be asking Dr. Apkarian a series of questions about the impact of pain on learning and the brain, and how we can learn to focus on periods of pain relief. And then I'll give you a summary of how Aivo Health guides relief learning. So how it builds upon the science of pain relief. And then we'll have a question and answer period at the end. So first, pain is a very unique type of sensation. It's different from other types of senses. So for instance, taste. Whenever you have that first bite of cake and it tastes, you can feel all the flavors in your mouth and they sort of explode, the sweetness and all the different flavors that work together. It's very salient, it grabs your attention. But you'll notice at the end of the cake, at the end of the piece of the cake, it tastes good, but it just doesn't taste that good anymore. It sort of habituates. It's called sensory specific satiety. This is something that is generalizable to other sensations, even smell. So if you smell very strong cheese at first, it'll really get your attention, but after a while, you don't notice the smell as much. And even with sounds, if you live near an airport or by a train station, at first you'll always notice the roar of the plane or the roar of the train. And after a while, you just sort of get used to it. And this is something that all of our senses share, which is the more of a stimulus you receive, the more you get used to it and the less it demands your attention. But pain isn't like this. Pain is the only sensation that you don't get used to. And that's one of the reasons why it demands our attention and one of the reasons why it is so important in learning. So that's my very general introduction to the harder stuff that I'm going to be asking Dr. Apkarian about. And before we even get into it, I'd like to ask Dr. Apkarian, what is your current understanding of pain? How would you define pain?
Well, maybe you should call me Vanya. So
okay, Vanya.
Makes it less formal. And how would I define pain? Well, I mean, pain is, as you were mentioning, is a unique sensory modality. Obviously, pain is something with which we all know we protect our body from injury. So in a sense, the common idea that you don't burn your finger more than once in your life. In a sense, you put your finger on a hot plate, it burns, you withdraw it, and you don't do it again. So it protects your tissue from injury. It makes you live a happy life. And by and large, most people, most of the time, most of their lives live free of pain. And that's a satisfying state of beingness, in fact. So, but pain has also both its acute and chronic phases, right? And I don't know if we should just jump into that or not, but even the acute phase of pain, what we know a lot about is that as soon as it happens, it sort of leaves a trace in your brain that you remember for the rest of your life. This is what we're saying. You don't do the same event again because you've learned it and you try to avoid it. So it's this avoidance behavior is defined by the memory trace of the pain, not the pain itself, but what's left over from that experience. Okay, and so you have here a number of things I could
Yes, to ask you about.
to ask you about, and yes, obviously, there you have the hand on a hot plate, and of course, the first thing that happens is attention, right? You cannot not attend to pain in a sense, especially when it acutely happens or when it exacerbated when during a flare, which is something you want to talk about later on, I think. And yes, and it drives you to change your state of beingness. You want to escape or to fight or remove yourself from that situation. So there's a huge response properties, right? You have a behavioral fight or flight kind of drive. You need to do something to improve your survival. So so pain simply improves your survival.
How do emotions get into the mix? Why is pain emotional?
Well, I mean, the emotion is the motivator for pushing you to do something, right? So anyone who is attending this webinar has emotionally invested in this experience, and that's a positive experience. On the other hand, if you really want to push yourself away from something, you need to have a negative emotional sort of cloud within which you make decisions. Um, and of course, the pain and negative emotions cannot be dissociated from each other, right? Essentially, we tend to think of them together. The intensity of pain does not make sense unless it's emotionally negative. That's what we call pain in a sense, and the learning is something I just briefly touched upon. Pain is fundamentally the strongest sensory modality with which we learn the fastest the fastest learning, and the longest learning trace is all associated with pain.
We have a bit of although I normally would wait until the very, very end to do question and answers, we do have an interesting question from Helen Robinson. The idea that pain threshold can change over time. And so what are some factors that go into why pain threshold, which is the point at which, well, first you can, if you want to define what pain threshold is, but why a pain threshold may change?
Well, I mean, so classically, we define pain in relation to the injury, and in general, for acute painful conditions, that's usually is true. On the other hand, pain is a cognitive emotional construct of your environment. And in that sense, any other cognitive interference is going to change your pain behavior. So, simply you get distracted by another loud sound or by another painful event, and your response to that stimulus that was painful before can become less painful. So there's a whole variety, in a sense, the whole environment within which you exist is going to modulate your pain behavior in general, and of course your pain threshold with it as well.
And in terms of how pain threshold can change, although that's sort of jumping ahead a bit, whenever pain becomes chronic, there are a number of changes in the nervous system that can occur that can subtly modify pain threshold. And that can be anything from attention. Are you paying attention? Like you said, Dr. Vania, are you paying attention to the stimulus? What is your level of anxiety at this moment? Have you been anticipating greater change, or
So, I mean,
greater
that-
pain?
maybe before we jump into all of that, let's make a little distinction between this acute perception of pain versus the chronic state of pain. We think there's a huge difference between the two. The acute event is usually associated with, sunburn gives you pain. And a few hours later, the pain goes away, which is great. And one lives life happily ever after. But when it becomes chronic, it becomes far more complicated. Many more brain circuitry are now involved in it. And in a sense that the chronic pain can be really simply thought of as the accumulation of the memories of the painful experiences that are persisting. Now, the pain is still very real. The perception of the pain is localized. You never confuse your headache pain with your back pain. There is no confusion. So there is a real physical process. There are information coming into the brain that differentiate these things from each other. On the other hand, the level of the suffering, the level of impact of the pain that's continuously ongoing is far more impactful on everyday life and has many more dimensions involved in it than acute pain. And in that sense, chronic pain is much more complex, and it's much harder to unpack in a sense.
Something that this, and I wanted to talk about pain flares just because this is something that people with pain experience on a weekly, monthly basis. So it's a really it's a salient way to address this. And it occurs to me that as we're discussing the difference between acute and chronic pain, pain flares kind of tap into that as well, in that there's sort of a background layer of pain onto which periods of acute pain like symptoms may occur. And these are dramatic exacerbations in pain that can rise within minutes or hours or days. And they're typically associated with some pretty just distress, because it's usually the magnitude of pain increase doesn't really correspond with what happened right before it. So this is something that drives a lot of people's.
So sorry, Melissa, let me be my old scientist and first spend a minute going through what you're showing here. You're showing here the variability of someone who's rating their pain, let's say once a day, the amount of their pain from a scale of 0 to 10, 0 being no pain, 10 being maximally painful state. And in the first 7 days, that pain is quite high. It's around above 5 or so or something. And then for some reason it goes down. And then occasionally day 10 or so, it pops up again and goes down again, etc. And those ups and downs, which you call them flares, which can have different duration and different intensities, different characteristics. We don't really know exactly how these things are happening, but what we do know is that they are going to happen in any chronic pain patient often, and in many different patients in very different characteristic patterns. And those characteristic patterns probably, or most likely, correspond to associations that can exacerbate their pain, essentially. So these are both learned experiences and even unconscious associations that have been created in their brain based on their lifetime experience of their pain with their environment, in a sense, right?
So it could be every time they do a certain activity that they expect to exacerbate pain, that might amplify something.
And even something stupidly trivial, for example, every time you enter into a room that in the past you had an experience of bad pain, unconsciously entering that room again can re-amplify, in a sense, the pain that you're in. But what we do know for sure is that these events that are these flares are highly disturbing. And in a sense, that's the whole definition of pain, right? It's emotionally disturbing. It's emotionally uh, 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 disabling in a sense, and one has to learn to identify them and to create strategies to deal with them in a way that we can rationalize the pain itself and hopefully be able to minimize them and in time minimize their occurrences too.
Would you say that while someone is in the middle of a pain flare, that that's a heightened learning state?
Well, every time pain is high, it's a heightened learning state, right? So yes, of course, by definition. And in that sense, the chronic pain patient that's having flares is always learning the wrong thing. They're learning the avoidance, they're learning the bad experience, they're enhancing the negative value of these conditions. And while in fact I think what Aivo would like to teach people is that one has to learn to do the opposite, to try to cope with the condition. You have to still cope with the condition. That's still a disabling condition that you need to generate strategies to cope with it. And then also when the flare goes down, it's a state within which you can then appreciate what is going down and sort of uh, celebrate the flare going away, and in that sense enhance learning of the positive components of the experience. And by reinforcing the positive component of life, one hopes that these flares will decrease in their both intensity and duration, and the pain becomes more acceptable, less disabling, and in time could completely go away.
Mhm. Okay, fantastic. I want to, so based on some of our discussions before this and just based on your work, I prepared a visual that gets at some of these concepts. And I wanted you to, so in terms of how the brain adapts to chronic pain, how would you, I think that,
Well,
how would you explain how the brain changes? Like you've sort of talked a little bit about these building of memories. How does that happen? How does the building of a pain memory happen?
well, I mean, there's a lot of detail that we're still working on. So let's not say that we know everything on the subject. There's much to be done. But what we do know is that, in fact, these very important brain circuits, the whole emotional, so the brain learns fundamentally by emotional associations. That's called reinforcement learning. And in a sense, you learn what is positive in life and you learn what is negative in life. And those define your motivation of behavior. So now, a painful state obviously is going to enhance the negative emotional learning. And that learning in turn will create these memories, which will perpetuate the state of the pain itself. Um, and I don't know, this diagram, it sort of looks complicated, but I'm not sure if it says much of anything besides saying that emotional learning is important for pain. And that's, I mean, of course, that's the whole general sense. And that, I mean, but so the pain does have a specific source of perception. Again, I don't want to say that your pain is only in your brain. Your pain is very real. The pain is something that one is suffering with. There's no question about that. But it is not simply the location where the information is coming from that's dictating that pain anymore, especially when it's
Meaning the body part.
right. It's not just your joint, it's not just your head, it's not just your back. Uh, those regions are involved, but those regions, the amount of information coming from those regions and how your brain is interpreting them has changed. And so that interpretation is something that we think we can unpack, unlearn, or relearn in a sense to be able to decrease its intensity, its impact on everyday life. So, and all of that is a learning process. And yet the negative learning needs to be counterbalanced with positive learning in a very simple way, right? And the rest of this diagram is complicated.
So here's so one of the things that you've brought up before is sort of the fight or flight, both the negative emotion and then that arousal state. So can you tell us what those two things do?
I mean, the fight or flight is more important for acute pain, I think, in general, because since a subject has a chronic pain, they really, are constantly trying to live with it. And in a sense, I think a lot of this fight or flight concept becomes dulled down, and it is not necessarily as sharp as it used to be. So its appreciation is not as salient anymore. And in that sense, one is suffering without necessarily knowing how to get around it, right? And since the pain is always there, the flight does not make any sense. The fight does not make any sense. You don't know what to do. So all you have are these negative emotional signals instead, which keep amplifying themselves and perpetuating the state of chronic pain.
So the antidote, as you've described, is these periods of pain relief and learning about how to harness these periods whenever pain is lower. I asked you some very simple questions about what is pain. What is pain relief? How would you define pain relief?
Yeah.
And I ask this because a lot of patients, people with chronic pain, they have varying levels of pain, and there gets to a point where there's sort of a mentality, I still have pain. It's less pain than it was yesterday, but I still have pain, therefore I do not have pain relief. And it creates this black and white thinking, either have pain or I don't have pain.
Yeah. Instead, what we would like to emphasize is the change in pain, right? So that, you have a flare and then the flare goes down. At that period of the flare going down, appreciating that state, in a sense, since humans by and large, or organisms by and large, essentially live pain-free, and we don't celebrate being pain-free, which we should celebrate. And so one assumes when the pain goes down, you simply go on with your daily life and you ignore that event. Instead, what we would like to do is emphasize the process of the relief. Now, the relief can happen again from many different ways, different pathways, different mechanisms, because in the case of chronic pain, first of all, it's an individualized state. Each person brings in their own past experiences, their own past memories, their own past quirks of who they are, which define the properties of their chronic pain. And in a sense, as a result, for each person, the relief has its own unique properties, but each one of them is an opportunity to memorize that event, to enforce that event, and to fight with that, the flares in a sense. So every time there's a pain relief, it's an opportunity to learn, to enhance learning, to expand the appreciation of the pain relief, and to celebrate it.
I love the focus on celebrating. So
yes. I mean, and so this is something that we have discovered, and you know very well, in a sense, that chronic pain patients are optimistic people. They tend to constantly look for some of these things, and it doesn't. I mean, you have to do this to some extent. We just need to reinforce that process. Otherwise, pain is a debilitating state. Otherwise, pain would put you in a corner where you would not move anymore, you would not function anymore, and you would not be able to live. So our natural, positive sense is, in a way, is the drive to fight against chronic pain, and enhancing those positive pathways for pain relief uniquely for each individual, given their past experiences and their past memories, is the way to individually help people cope and get a better quality of life in time.
Okay, makes sense. And just to reinforce this, I want to share this visual of what you've just described.
Right. So again, I mean, this is a graph of pain intensity that a subject is supposedly rating over time, over many days. On again, a 0 to 10 scale, where 10 is the worst pain you could imagine. They have a relatively high pain, and they have these episodes where you have with red dots are showing episodes where the pain is going down, and those are again time windows within which positive relief learning it should be optimized, and one should first identify those episodes, reflect on them, and in a sense reflect that what did I do in the last 15 minutes or yesterday that now I am in a better pain state, and make that a strategy that could perpetuate itself and enhance these episodes of decreasing pain instead of the episodes where it's increasing. And in a sense, naturally, those flares again are fighting against this process. They're trying to reinforce the bad memories in a sense, which you want to decrease.
And
they're not bad memories, they're negatively, emotionally, weighted memories, right? Yeah.
And this is the same person who had this is a person who has used the Aivo app before. One of the things I wanted to jump in about this and reinforce is that by rating pain multiple times a day over a period of time, you as a person with pain, and also groups like Aivo, are able to identify these periods of pain relief more easily to sort of bring your attention to them. So this is this same pain trajectory as that we were looking, but instead of highlighting the areas of pain flare, it's highlighting the periods where pain is reducing or low. And so this is a sort of a real world example of what periods of optimal pain learning might look like whenever pain is low and steady or decreasing.
Right, and so those are in fact windows within which, with the proper strategy, one could further enhance those states of beingness, and in a sense, doing this continuously over weeks and months has the opportunity of dramatically decreasing the chronic pain, in a sense, down-regulating the associations of that pain with the brain circuitry that have been reinforced by negative learning. Right. So again, I should still emphasize that the pain is very real. It's highly localized. It comes and goes, but the brain is interpreting its value, its intensity, its impact on the organism. And so that's the component that we can modulate, and by that modulation, decrease its impact on everyday behavior. And in turn, and pain is also, we have learned, is a very sticky kind of thing. So if it stays up, it tends to stay up. It stays down, it stays to stay down. So in a way, if we enhance the staying down events, we have a real opportunity of dramatically decreasing at least the suffering and the associated painful experiences and the disability that comes with it. And one could seriously think of this as a cure, right, for people with chronic pain.
So along that lines, I'd like to share if we were to distill this into two principles for pain relief learning, and I've prepared this based on our conversation before, when your pain is increasing and strong, so even if it isn't during a flare period per se, but whenever compared to how it normally is, if your pain is increasing and strong, you'd be more likely to benefit from certain types of strategies, pain management strategies. Definitely pacing, relaxation, guided meditations. If you have coach support, that would be optimal, or psychologist support, and compassionate self-care. So this isn't a time to this is a time to be gentle with yourself and very loving with yourself, and making sure that you aren't pushing yourself past your limits. Alternatively, when your pain is decreasing and stable, this is the optimal period for pain relief learning. So whenever pain is low and stable, this is whenever you'll get the most from things like pain education, challenging negative thoughts related to pain, anxiety and fear reduction. So working on the strategies, the emotional regulation strategies, and practicing different coping techniques, so you know exactly which things to choose from whenever you get to the point where the pain is increasing and strong, so that it reduces the pain whenever that happens. And also, whenever your pain is decreasing or stable, that's an optimal time, as Vania has mentioned, for positive emotional learning or celebrating. And it's to be able to do that, you have to notice the period that pain relief is happening in the moment, in order to really harness the strength of this type of learning. So it's noticing first, and then adapting your strategies around whichever period you're in. Would you say that this is an accurate reduction of what you've described?
Yeah.
Okay.
That's definitely the general idea, for sure. Yes.
Okay. Excellent. Excellent. Okay, so I'm going to go ahead and shift into the last part of the webinar, which is describing how Aivo Health has been trying to optimize this process of pain relief learning. So what I'm going to be doing is I'm going to summarize a couple of different things that we've been focusing on Aivo Health, ways that we've been trying to personalize pain relief learning for each individual person with pain who uses the app. So the first step of Aivo's personalization is daily self-reported ratings of pain, mood, and sleep. And daily ratings are sort of how we listen to the heartbeat of people's pain. So the pain heartbeat gives us, allows us to give a person continuous personalized care based on what they need on a specific day, because everyone has different needs, because everyone's pain changes in different ways. So for example, like I've said before, we encourage patients to use our educational material more during periods of pain relief, because that would be an optimal time for relief learning. And on the other hand, if your pain heartbeat shows that you're in the middle of a pain flare, our coaches are automatically alerted to send you a message, give you the support that you need, so that you get some empathic support that's more appropriate for that part of your pain fluctuation. And again, this is to optimize harnessing these periods of pain relief learning. And the second step of Aivo personalization is something that we call Aivo biotypes. And biotypes are directly based on the peer-reviewed research by Dr. Apkarian, or Vania. And a biotype is sort of a collection of major psychological dimensions that drive each person's pain experience. And so far, we've identified 6 primary psychological dimensions that contribute to biotypes. And that includes optimism, which Vania said is actually higher than we would expect in people with chronic pain. It also includes emotional awareness, flexible attention, body awareness, pain anxiety, and adaptable coping. And every person expresses varying amounts of each of these psychological dimensions. So by identifying the major dimensions that drive your pain experience, the biotypes have a way of highlighting your psychological strengths and also drawing attention to where you might need a little bit of help. And that's where the biotypes come in. So in that way, the biotypes sort of act as a compass that directs us toward the optimal treatment pathway. So pain is equal for all biotypes, but because the experience of pain differs, your responses to various treatments will also differ. And in fact, Dr. Apkarian's research has shown that different biotypes are more likely to respond to different types of treatments than others. So biotypes are a way to help us select the optimal treatment pathways for people who exhibit specific psychological profiles so we can maximize the overall pain relief. And in the Aivo app, these treatment pathways are called tracks, and they're sort of tools. Aivo tracks consist of different treatments that mimic the kind of care that you would get in a multidisciplinary pain clinic. And there are less of 30 or fewer than 30 of these in the United States. So this is very high quality psychological care. These tracks contain evidence-based psychological approaches from mindfulness-based stress reduction, cognitive behavioral therapy, acceptance and commitment therapy, and pain neuroscience education. And you can see here, this includes relief learning, tools for positive mood induction, pain education, embodied relaxation, movement, guided meditations, sleep hygiene. These are each packaged into 3 to 5 day tracks that focus on these dimensions that you see here. So to determine which tracks or which tools are most beneficial for you, we look at your heartbeat, your pain heartbeat before and after each track. And if pain improves after a certain kind of track, we give you more of what helps you. And if pain doesn't improve, or if it stays the same, then we switch to another type of tool that will help you more. And this all happens within the app. And to date, based on the findings of our first clinical study, this approach works beautifully because almost half of our study participants reported an average of 42% pain relief in 8 weeks. And they also slept better and reported better moods. So we have a lot of confidence in this approach, and it's sort of in the state of becoming, and that we're always constantly improving the approach. So the take-home messages, I'm going to try to bottle this all up. First, chronic pain is driven by emotional memory, and these emotional memories can be changed by strategically working with the pain memories. One way to do this is through relief learning. And relief learning focuses on the importance of the moments with low pain and infusing those with more positive emotions and celebration. And the Aivo app is designed by neuroscientists and pain psychologists to optimize exactly this. So with that, I'd like to open up the field to some questions and answers. I see that we have a few questions. One, Gary has asked for Vania. Is there one specific part of the brain that deals with pain? And if so, which part is it?
Oh, that's a great question. And in fact, it's a debate that has been going on in the field for more than 100 years. And we all throw mud at each other's face because none of us agree on the answer. And on the other hand, I mean, there is some very good science. In a sense, we have yet to find a dedicated area in the brain for pain. So no, the pain is in fact much more likely to be a distributed brain state of beingness. And in a sense that it's an integrative, constructive state of beingness. Obviously, the injury and the location is always a contributor to it, but there's many more dimensions that come to it. And I was having this discussion with Melissa a few days ago, and now I'm actually excited with the concept that in fact, pain in different societies probably have very different properties that has essentially not been studied in the past at all. In a sense, the history, the education, the exposure of the norms of any given society will differ from one society to another. That's what our brain, in fact, creates and imbibes in a way, both at the same time. And that's what we are. You know, I'm an Armenian from Syria who has lived in California and Syracuse and now in Chicago. That's a very complicated idea. But whatever it is, within that system, my pain is uniquely, has been shaped with all of that at the same time. And so I'm a proponent of much more integrative, constructive idea of pain, and that idea has given us some good notions. Of course, the classic idea has been that the pain is represented in a very precise area in the brain, and it has to do with the part, your body part that's been injured, and that one-to-one correspondence is the pain.
Mm.
I'll stop. I can go on this with this.
You can.
I'll just stop that discussion, right?
Well, well, there's also a related question. Is there an easy explanation for why some people have such varying pain thresholds? So Gary, for instance, says that I've always felt like I had a very high pain threshold even before he encountered chronic pain.
And I happen to have a very low pain threshold, so I don't think there is any real relationship between the threshold. And I mean, I think of myself as a wimp, for example, but that's neither here nor there. I mean, I don't think pain threshold has any real relationship to acute. I mean, obviously it has some relationship to acute pain. It has no real relationship as to the propensity of becoming a chronic pain patient, for example, or not. We have shown repeatedly that acute pain properties have very little explanatory value about chronic pain. And in a sense, you can see that the two exist essentially independent of each other. Just because you have, let's say, a chronic back pain does not mean that you don't feel a pinch on your skin, on your back. Of course you do. And you do it beautifully, and you do it very nice, very just as well as as a person who doesn't have the chronic pain. So the interaction between the two is not obvious.
And one other question is related to relief learning. So let me try to rephrase this. If you have sustained periods of higher pain, how can you use this idea of relief learning if you don't have a lot of times whenever you experience what you would perceive as relief?
Yeah, I mean, obviously that's a harder situation, right? So in a way that the episodes of relief are shorter, but paying attention to those episodes specifically, and again, celebrating them as, you know, with positive reinforcement, saying, look, right now, you know, I was suffering for the last 3 days with this terrible pain, but here is 3 hours where that has dramatically decreased, and I'm going to remember this and note this and try to sustain it as long as possible. I think that's the kind of process that should shrink the high pain episodes and expand the low pain episodes in a way. And again, pain is a sticky system, so that the one that you can reinforce more will itself sustain itself longer also.
That really highlights also the importance of attention. I don't think that attention is emphasized as much in pain management in general, but what you're really highlighting is that what you pay attention on is where your consciousness flows.
Yeah, but I mean, and also it's also natural, you know, the natural state of the human being is to assume that you are pain-free. So when the pain goes down, in fact, you're distracted from your pain and you're doing all kinds of other things, and you don't even appreciate that you're doing it unless you reinforce that process and make sure that pay attention to it and register that somewhere in your brain and keep that tab so that you can go back to it in a sense in the future. Yeah.
Excellent. So thank you so much, Vania, for this this conversation. I think that we're about time to wrap up here. I want to thank everyone for participating, and for people in future who are watching this in the future, please, you're welcome to come to aivohealth.com, AIVO health.com, to check out the app and to test drive relief learning yourself. And thank you again, Vania, for joining us today and for sharing your wisdom. Thanks. And your experience.
It was fun to do, yes, yeah, yeah. And thank you everybody for joining, yeah. Bye-bye.
Thank you so much. Okay, take care.
Yeah, bye.